Liposuction, what are the possible complications you might end up in? If you ask me, one single complication I am worried about is pigmentation. Say example, the tummy liposuction we are doing, making a small hole and sucking out the fat all over this area. What happens is the skin over the suction areas sometimes become dark. The darker pigments won't go even after 6 months in few cases. So it is not very common in the white skin people, but very common in our darker skin people. Why it is happening? Because when we do a liposuction, we do create something called inflammation inside the subcutaneous space between the skin and the muscle. Sometimes our cannula goes very superficial to give a good results. What happens is the subdermal melanocytes. The melanocytes is the cells which are responsible for producing the pigmentation. These melanocytes get activated. Because of this melanocyte activation, because of the inflammation in this area, there is something called post-inflammatory hyperpigmentation happening. Because of this post-inflammatory hyperpigmentation, that area becomes dark. So this pigmentation usually start disappearing from the second month onwards, but sometimes even 6 months it will persist. So because when they get this pigmentation, usually what we do is we'll give them a lot of tablets like a glutathione and a lot of skin lightening agents, and even after a few weeks we'll put them on few creams so that the pigmentation will comes down. Once after 2 months, once everything settles, even the pigmentation persists, we'll send them to a dermatologist. They'll put them on a few chemical peels and few other skin like lightening agents so that they make it even lighter. You need to understand this pigmentation issues so that you'll be mentally prepared when you're going for a liposuction.